Assalamu alaikum. This is a simple nephrectomy on the left side, sharing the series of the pedicles. There is another variation here. This lady presented to us with a non-functioning kidney having gross hydronephrosis and hydroureter till the lower end, most probably the sequelae of a left ureteric injury during transabdominal hysterectomy. So here we can see that we have found an artery here. So we will clip this artery and then see if the vein is collapsing. And then we saw that the vein was not collapsing, so we thought there might be another artery. As you can see, the second artery is curling around the renal vein and going into the parenchyma or the hilum. Since this artery was arising almost from the anterior surface of the aorta, that's why we had to make sure it's the same artery which is winding around the renal vein and then going into the renal hilum and not any other artery supplying any other portion. Here you can see that the pull on this artery is pulling that artery in the hilum. So we clip this one as well, and now we see that the vein has collapsed and it is not distending. Then dissection with the right angle along the posterior aspect of the renal vein to apply 3 clips minimum, 2 towards the major vessel and 1 towards the kidney. Now cutting this vein in small pieces and also keeping that artery away, which is behind it. So the last bit is done. You can see the wall of the artery. It is now being separated. The last bit is done with the vessel sealer, so that there is no untoward event. Now dissecting the arteries further and applying some more clips in order to complete the pedicle. And now dividing the arteries. 1, and this is another one. Thank you very much for watching.